We have received a number of questions and won't have a chance to answer all of them, but I just wanted to turn it back to Tom for a moment. Um, Tom, your presentation really queued up some of the significant impacts on health, some of the downsides of loneliness and social isolation. And we're wondering, are there any upsides that you have seen when it comes to older adults and how they handle a pandemic like this one?
Yeah, thanks for that question, Megan. I think that the phrase upside may not be the exact phrase I would use, but I think that it's really easy to forget in a situation like this that older adults are experienced adults. Older adults are resilient. You don't get to 70, 80, 90 without weathering many challenging times and finding the strengths to cope with some difficult situations. So in the data that I presented, there was a skew to the left in terms of loneliness. Many people said, I'm not lonely, despite the fact that during the pandemic, I think most of us are lonely to some extent. Um, and I think it's because of a resilience factor. I think that many older adults, and maybe this is cultural in Maine, I think it's more broad than that too, because of that life experience, they know how to manage and to cope with short-term setbacks. However, there were people, obviously, in our survey, and I know there are many people in the community that are objectively both isolated and very lonely. And despite the fact that they have resilience features, for them, drawing on that past resilience to cope in the present might be really difficult. So I would say that number one, that we don't want to typecast older adults as a group that's entirely vulnerable and always at risk. In fact, I think quite the opposite. They have a lot to teach us in this pandemic in terms of how to cope. Part of our role, though, with those that are really struggling is, I think, to harness those latent strengths, to identify ways to draw on past memory and resilience to cope better in the future. Early in the pandemic, one of my legacy scholars was struggling, and we made an effort early in the pandemic to phone everybody on our list to do a check-in. And I happened to get this person to call, and she's like, "Oh my God, I'm so glad you called me. I've been feeling despondent. I don't have internet. I don't have many friends because I moved to Maine later in life. And, I've actually been feeling suicidal." And that phone outreach made a difference for her. And part of what we talked about that day and a few other days when I called her, and then another legacy scholar started calling her, was to identify those latent strengths and interests. And what's really exciting about that story is after a couple of months, she was a different person because she was finding new ways to interact with other people by using her telephone and through socially distanced activities outdoors in her neighborhood that initially she thought she couldn't safely do. And so, number one, older adults are very resilient, and that's a good thing. And number two, even for those that are struggling, it's possible to harness that latent resilience, those latent strengths, to make a difference.
Wow, thank you, Tom, and thank you for that powerful anecdote as well, which again I think emphasizes the little things that we can do as a community for our population, for our neighbors. So thank you. One of the questions that came in early is for you, Leana, and it is specifically asking about what advice or recommendations do you have for an organization like Southern Maine Agency on Aging as we look to address individual community needs through our programs?
Thank you so much for that question. And I think the first thing I would say is, while it is important to understand and recognize disparity, it's equally important not to assume a deficit. And to Tom's point about the resilience of older adults, the same is true. And in many ways, uniquely true for some of the communities that I have really been focused on, in that they have often experienced trauma or discrimination throughout a lifetime, um, and yet are still here, are here and are a really vibrant and important part of their communities. So beginning to understand that disparities exist, but not treating them as a deficit, and recognizing that it is actually the communities themselves who often best understand their needs and are best trusted to deliver the care in response to those needs. So really the thing that I would say is it's important for all of us to do some of this work internally first, right? So really to be able to take a hard look at what programs do we have? Who's using them? Who's not using them, right? Let's not make assumptions about why, but let's understand where there are differences in utilization first, right? Then let's look at our staff. Let's look at our board. Let's think about whether or not we are really representative of the communities that we seek to serve, or whether we have some work to do internally in order to be so. It's very easy to say, I want more Latinx people to be utilizing our program, and so I'll just call somebody who I know is a leader in that community and try to make that connection. But we often skip the step, which is, how did we design this? Who's behind it, right? What are the faces of this program? What are the faces of this work? And how is that really affecting the way in which we design and implement our services? So I would say the first thing you can do is really do that internal audit work and make a commitment to really getting the education amongst your own staff, and or thinking about the composition of that staff to make sure that it is adequate in order to represent the communities that you need to serve. And then I would say it is really important to go to community. I think we often sort of have and I say we because I think state government did this too, a little bit of a if we build it, they will come attitude about services, right? They're necessary. So if we build them, they will come. But that just doesn't always translate culturally for many people. And so we have to go to and really be part of communities in a much more meaningful way. And SMA actually participated in some of the work that we did later on around vaccination to really get homebound individuals, many of whom were older adults, some of whom were not, but many of which were, really getting them to vaccination or bringing vaccination to them, which required outreach, right? It required that we really took stock of who's using what programs, who do they know that isn't maybe using the program that we wouldn't be able to get to. Picking up the phone, calling household by household, and then figuring out how we were going to get providers and vaccine to individuals who couldn't get to us. If we took that approach more readily to a lot of the things we did, really thinking about who needs the service, how do we figure that out? And how do we then bring that to them in a meaningful way alongside partners they trust, and begin to really share resources with those partners in a way that enables their infrastructure to grow and develop in order to serve their neighborhoods and their communities. I think we're going to see much greater outcomes for individuals from those communities.
So, Donato, one of the questions that has been asked by our audience members, and keep in mind our audience members are everyone from a donor to the agency to, like you were saying, a professional who works in this field, or maybe somebody who's caring for a loved one with dementia. We're just wondering, what can we do as individuals to combat social isolation and loneliness?
It's a great question. And, my favorite philosopher, Yogi Berra, once said, you don't want to make the wrong mistake. And I think we are all trying to find this major solution. However, as I said about a year ago in a op-ed that I had written for USA Today, just ask the question. And so what I do a lot of times now, when I'm at a dinner, anyone that has dinner with me now knows that I always have a question at the table. And that question might mean, tell me about your best birthday. Tell me about the person to whom you miss most. I get people to talk, and then in that conversation, I can begin to pick up whether somebody is struggling. Let me give you a great example. I recently had dinner with a woman and 18 other guests. This woman was 91 years old, and I knew she was missing her husband, but I wasn't going to ask the question, Vera, are you missing your husband? So I asked the question, who is the person, somebody you know or a famous person to whom you miss most? And I didn't call on her first, but I did call on her like the second or third round. And she opened up about her husband, Frank. And as she was talking, she was beaming. You know, we had a 16-year-old at the table, we had middle age, and everyone just started to really lighten up. And you could see she was lighting up. This was a story about her husband, Frank, who died a few years ago. And I bet in the last few months, she hasn't had an opportunity to share it. And so you don't have to ask, are you lonely? You can ask questions that will support someone's relevancy. By the way, I'm convinced loneliness is associated with your sense of relevancy. If you don't feel relevant, and that sense of relevancy diminishes as you retire, as you lose your partner, as your neighbors move away, your kids take the car keys away, there's an accumulation. So keep people relevant. Ask them about their stories, and you can begin that by having a question at the dinner table.
Thank you. I love that.
Hmm.
So relevant and always comes back to powerful questions too.
Well, it's funny, a lot of people now who get re-invited to my dinners, they're always worried, and they try to reach out to my partner Jeff. Do you know what the question is tonight? And but many of them have learned something new about the friends that are at the table, and it's been one of my signature um, approaches to how I want to connect with people. It's not just about having chicken cordon bleu at the table. It's about really getting to know people.